The role of self-compassion in the mental health of adults with ADHD. Attention Deficit Hyperactivity Disorder, or ADHD, is a highly prevalent disorder whereby an estimated 3.4% of adults aged 18 to 44 globally are estimated to have ADHD. Studies report that up to 50% of people with ADHD traits experience depressive episodes or increased anxiety. People with ADHD also have a lower tolerance for stress, labile moods, and higher levels of perceived stress compared to individuals without ADHD. Moreover, people with ADHD report lower levels of life satisfaction, quality of life, and overall well-being. Emerging evidence suggests that self-compassion may be particularly important for the mental health of adults with ADHD. Therefore, there is a need to understand the potential role of self-compassion for the well-being and ill-being of adults with ADHD. This is an important aim that can inform interventions targeted at improving mental health in this population. Henceforth, this study investigates if levels of self-compassion may explain the mental health outcomes in people with ADHD compared to people without ADHD. A total of 543 adults with ADHD and 313 adults without ADHD completed questionnaires online to measure levels of self-compassion and mental health. A structural equation model assessed the mediating effect of self-compassion on the relationships between ADHD and well-being, as well as ADHD and ill-being. The results of this study demonstrate that levels of psychological, emotional, and social well-being are all lower in adults with a diagnosis of ADHD compared to adults without ADHD. This is the first study to show that all elements of well-being are reduced in people with ADHD. Both ill-being and well-being also differed significantly in people with ADHD compared to people without ADHD. It also showed that lower levels of self-compassion associated with ADHD were a partial contributor to both the lower well-being and higher ill-being as observed in the participants with ADHD. With consideration to related research, this study suggests that self-compassion is a contributing factor to the overall mental health of adults with ADHD. It also highlights the potential benefit that self-compassion interventions may have for mental health in adults with the condition. This is the first study to provide evidence that the way in which adults with ADHD respond to themselves during times of suffering or failure partially explains their poorer mental health. Consequently, the findings support and extend theory and knowledge about the mental health of adults with ADHD in several important ways. Further, it highlights potential avenues for future research. The findings also highlight the potential of self-compassion as a positive addition to clinical practice. This could complement other empirical interventions to improve self-regulation, resilience, and mental health in adults with ADHD.